Hi, Scott Morris here from Morris Consulting Associates. Well, in today's podcast, we want to talk a little bit about inventory management and how that really is one of the keys to healthcare reform. I know it may sound a little weird, but think about it. As healthcare faces really tighter profit margins and we face reimbursement cuts, our healthcare system needs to keep supplies lean and unnecessary expenditures low. And this is going to impact pharmacies and hospitals, clinics of all sizes, opticals, and many, many more areas in the healthcare community. So I want to take the next 3 minutes of your time to talk about how we can streamline this process. So let's spend the first minute or two talking about what's really at stake here. Well, there's a couple different points we need to talk about. The first point is, how do we keep in compliance with our contracts? And what I mean by that is, most of us probably, hospitals, pharmacies, buying groups, we all have buying groups that are really, to the most part, underutilized. And this really impacts us because we signed up with buying groups to help decrease our costs. And by utilizing these in a more full capacity, we're going to help enhance our cost savings. And so we need to figure out, if we're going to utilize that, how do we better utilize those contracts and help enhance our relationship with those buying groups. Now, the other next piece is we got to talk about really pieces of equipment. We're going to talk about two versions of this. One, we're going to talk about the expensive pieces, the pieces that cost $10,000, $15,000, $20,000. And it's interesting, as we go around the healthcare facilities, we find out that many times those types of equipment are often lost or misplaced. Well, they're still in the hospital, they're still in the clinic, they're just not maybe where they're supposed to be. And what happens is then that causes a decrease in workflow efficiency, or people looking to find where it's at, or it takes a few minutes to move things. When it was there all in the right place, it was always there, but people didn't know where it was supposed to be. And ultimately this leads to underutilization, or in many cases non-utilization, just because we don't know where this inventory or hard equipment costs are. Then we look at a much bigger cost, but on a much broader spectrum, but a much lower cost, is looking at less expensive pieces that are typically purchased over and over and over again. And the problem is that maybe they're not put in the right place. So the staff, when they need them, when they need to sell them or when they need to utilize them, it's not where they're supposed to be. And then it becomes chaos as everybody kind of runs around looking for something. After that happens once or twice, the staff gets smart and says, well, let's order some of these and we're going to put these as our secret stash somewhere else. And pretty soon we have little stashes of stuff everywhere that only certain people know about. And the bad part about this is many times the staff is ordering this at maybe a much higher price than we could if we had bought it in bulk. Because they're saying, I want to order it so I know where it's at and where I'm going to keep it. This creates all kinds of problems, not only in terms of over purchasing, but many times it gets stashed into different places. We run into situations where those products become expired, or other people don't know where those products are, or those products are purchased at a much higher price. All of these lead to increased cost and decreased savings. Now, even more importantly, that it really leads to what we call decreased visibility, because now nobody knows where things are at. And that leads, as we said before, to product expiration and underutilization despite being present. This underutilization ultimately can create patient safety issues or decrease in consumer choice, which affects the revenue stream overall. In summary, when we have poor tracking or poor inventory management, or really what that leads to ultimately is inefficient purchasing and inefficient cost savings, as we are purchasing them from places we don't necessarily need to be. So those all create problems. And in the bigger picture, what this leads to is higher spending with really zero accountability, poor inventory management or poor inventory visibility, and ultimately increased costs. So, that's great. Many of you watching this said, I already know what the problems are. How do we fix this? And I'm going to give you what we call the 5 C's to fixing inventory management. The first one is, I want you to take a little time, schedule a time for each part of your office, clinic, hospital, and say, we're going to utilize these 5 C's. First one is, we're going to clean house. I want you to go in, take one area of your office, one area of your clinic, one area of the hospital, and say, we're going to clean everything out. We're going to clean all the drawers, everything from everywhere. We're going to put it in a central place, and we're going to sort through this. So the first thing is clean. Throw away everything that's expired, or better yet, if you want to be really humanitarian, take those slightly or close to expired products and donate this to some charitable cause that can go on like a mission trip or overseas to do something else. Instead of just throwing them away, donate them to somebody who else can use them, even though they might be close to expired. 2, I want you to take everything that's in there and categorize it by what you have. Whether you're using serial device tracking or whether you're using RFID technology or you're just doing it manually, I want you to categorize and say, this is for cardiac, this is for neuro, this is for antibiotics. This is what it, and hopefully you've got them all categorized, but what you're going to find out many times when you put them all in one place is that many things are categorized, some of them are even categorized correctly, but many of them aren't categorized at all. By helping do the categorizing, you're setting up part 3, which is to help compartmentalize what you're doing, compartmentalize your resources. And you're going to compartmentalize what areas these things go in, what personnel or what departments they belong to. So they know, the staff knows, everybody knows exactly what these products are for. Then number 4C is we're going to talk about something really important, which is collaboration. And by collaboration, I mean talk to the staff that actually uses these devices, these technologies, these products, and say, now, what do you use them for? Where would be best suited to put them? How often do we really need to order these? If they were in this location, would it help with our utilization? Instead of thinking we know where they go, maybe we should ask the people who actually use them every day. So instead of having secret stashes everywhere, we have one compact little unit. And collaborate with the staff and say, how would you like to order these? How would you like the process of us ordering, shipping, receiving inventory, getting them to you? That's all important. So we make sure that we have a team mentality of this, so we don't just kind of rebuild the same problems we already had. 5th C is create better controls. And by that I mean is establish some controls for how these things are utilized, how they're reordered, how they're purchased, and how they're received or distributed to the different people. Last C, and I added one, you notice in the beginning I said 5 C's, it's actually 6 C's. The 6th one is clean. Once you've said, okay, I know what I have, I know where we need to put it, I know where it needs to go, and whose department it is, we've talked about our control process, I want you to take the rest of the area and clean it up. Make things look clean, look orderly, look nice. That's very important. Now, the long term of this whole thing of implementing the 6 C's is saying, really there are huge long-term advantages to doing this. I know that during the process it may not be so fun, but those the long-term advantages of everybody knowing things at and decreasing your costs and having the products there that were necessary far outweigh what the short-term costs are. Hopefully you found this helpful. Stay tuned to our Flipboard page or our YouTube page as we talk more about and have more podcasts about how do we change our healthcare system for the better. This is Scott Morris. Thank you very much for your time.